Hi everyone, welcome back. This afternoon will be hopefully full of stuff for you guys and resources to help you continue on this path to learning more about OASIS-D. And we felt it was really important to help you all locate and identify where some of those resources are on the CMS website, the HHQRP website. So that's what this next 30 minutes we're going to be spending and doing, is learning a little bit more about that. So just with all the other presentations, the list of acronyms, again, this resource is found in your folder. So the learning objectives for this session is that by the end of this presentation, you'll be able to locate and navigate the Home Health Quality Reporting Program webpage on the CMS website, and also identify resources available to home health providers to enhance their understanding of HHQRP. And just as with other presentations, we have a disclaimer that the material that I'm presenting today was current at the time that it was developed, and that, as with things, they may change, but for the most part, this is where we're at. So we're going to be going over the HHQRP website. And just a quick polling question: how often do you visit the HHQRP webpage on the CMS website? So this is anonymous, so don't feel embarrassed about answering. So, okay, some rarely, some occasionally. Okay. Not getting many responses, only 41 responses. We have 700 out there, I think, right? Okay, so occasionally monthly, and that's okay, because as I go through this presentation, you're going to see me highlight some of these pages that might be better for your quality managers, some that might be better for your administrators, or even your OASIS educators. So, and I know some of you guys wear all three roles, right? So it's one of those situations where, you know, it all depends on what you're going to be going there for and how you're going to be utilizing it. We're really hoping to enhance that utilization today. So the HHQRP website, in this fan diagram, contains many resources for your agency to access. It displays a sampling of the different pages that make up the web page, and there are 8 pages that we'll focus on today. They include Spotlight and Announcements, Home Health Quality Reporting Requirements, Home Health Quality Measures, Home Health Star Ratings, the OASIS data sets, the OASIS user manual, training, data submission deadlines. So at this point, we are going to take a break from the presentation, and I'm going to show you a live demo on the actual website so that you can take a look at what this looks like. So you'll see my Google page here, and I simply type in HHQRP, just like that, right into the little window. And you'll see my window's purple because I do go there on occasion. And I just click right on that page, and this will take me to the primary page that we're going to be talking about. With this one, you're going to see individual pages on the left-hand side, and those are all hyperlinked pages that I had mentioned in the fan diagram. So this place is the place to start when we're just trying to find those resources that will support your quality efforts at your agencies. Like I mentioned, the tabs that are found in the menu box on the left side of the screen are hyperlinked. And the first tab I want to look at is the Spotlight and Announcements. So we're just going to go right there. How many of you guys have been to this page? Ooh, look at that. So occasionally, you'll get an invitation to get some feedback. We do suggest that you do that. However, for today, in the interest of time, I'm going to hit no thanks. Okay, yeah. Okay, so this page contains announcements for any upcoming training, Q&A, information regarding the erratas that are being released, and other notifications. Your administrators, quality managers, educators, OASIS specialists should all view this page on a routine basis. Note that the page is organized. I'm just going to slowly go down the page because I don't want to make anyone ill after lunch. And you'll see that the most current material is listed at the top, And it'll be most recent at the top, and it'll just go down in chronological order. And it stays up here for a little bit. And then I'm just going to come down. Here, there's the registration for today's training. Down at the bottom, you're going to see the download section. Oh, I'm sorry, there is no download section of this page. Let me go back. Okay. So after that, we're going to get into the home health quality reporting requirements. So this page contains an overview of the home health quality reporting requirements. When your administrator, clinical manager, or quality manager has questions about reporting, it actually may be found here. The site includes the different areas here, which include statutory authorities. It defines the mandated regulations for OASIS data collection. It identifies the COPs related to OASIS data collection. It identifies patients excluded from OASIS submission requirements, and it reports on the fiscal impact of noncompliance. I think that's a really important one. In addition, it defines the quality episodes of care, the quality assessment, pay for reporting performance requirements, and the formula for the quality assessment only. And then finally, in the download section, and I'm going to go on to, this one does have the download section, you're going to see more information, just down here at the bottom. Your agency leaders will find on specific memos on reporting requirements during natural disasters. So if you are unfortunate, your agency is encountering such a thing, this is a good place to go. Okay, so we're going to go back to the top of the page. And we're going to get into the home health quality measures. This page is great for quality managers, educators, or anyone looking for information regarding the quality measures. I actually do refer to this page often when training new clinical managers or quality coordinators. The site provides the foundation for the understanding of the OASIS data set, explaining how the OASIS quality measures are used and the implications for accuracy. And that's huge, right? That's the reason we're here, OASIS accuracy, right? There's a description of each measure type, including outcome measures, potentially avoidable events, claim-based measures, and process measures. At the bottom of the page, you're going to see another download section where more information regarding the proposed and final rule specification for different measures and tables organized by measure type. So as we move through it, there's your outcome measures, the potentially avoidable event, your claim-based, process measures, and again, your downloads. So read through the download section. There's a lot of valuable information there. Some of it is a little historical, but for the most part, it's good information for you to take a look at. The next page we're going to get into is your home health star rating page. This page provides your agency leadership information regarding the two types of star ratings: the patient survey star and home health consumer assessment of healthcare providers and systems, HHCAPS, right? We know that one, and the quality of patient care star ratings. This site provides information regarding where to submit questions, information on the patient survey star rating, which measures are included in the quality of patient care star rating methodology, the requirements for home health agencies to receive the quality of patient care star rating when ratings are updated, and information regarding the provider preview reports. If you guys have ever accessed those are valuable, valuable pieces of information. Updates, additional information, useful links, and downloads are included near the bottom of the page. And I really do find this one being really one of the most important pages for quality managers. The focus has shifted with the regulatory requirements that highlight the importance of a data-driven quality program. So this is a place to start, right, for that. Here's the information regarding some of the data you may want to use. So my quality manager friends, I encourage you to bookmark this page. Here is the listing of the measures that can form critical components for your QAPI program. Following that, I want to get into the data sets, the OASIS data set. Now, I know we talked a lot about OASIS-D, but remember, C2 is still in use today, right? This is where you're going to find that current version of the OASIS data set. You'll also see a link to the newest version of the OASIS user manual. Again, OASIS C2 for now. Having said that, eventually this is where you're going to find the new OASIS-D data set and all the associated materials related to it. And again, notice that this page, again, is in chronological order with the most current information located near the top of the page. And then near the bottom of the pages, again, is where you're going to find a download section and related links. And closely related to the data set page is the user manual, right? So CMS does not fall short on providing materials in multiple places to ensure you can locate them and have them ready for when you need them. This is where you'll find the draft OASIS-D guidance. I know that was one of the questions that came up. Where do I find the guidance? It's here. It is within that manual your eyes can feast on the actual new OASIS data set. Other resources such as the erratas, Q&As, and other information related to data collection can be found in the download section. I see this page as the most valuable page for your OASIS trainers, educators, clinical managers that support accurate coding. Okay. Home health quality reporting training. That's about what we're doing today, right? We're training, the quality training, right? This too is a great page for your educators, clinical managers, quality managers. However, I think this is the page for your nurses and therapists out there doing OASIS. It's where you're going to find the video recordings of past webinars and trainings, and you can use these. They're free. Use them. Again, train those out that are going out there to do it. These can be especially helpful for your nurses and therapists who are new to home care, and they're great for those who learn best by attending training virtually or by practicing their skills and knowledge checks with the scenarios that we provided. This page also includes the agendas and all the training materials, including the presentation, case studies, action plans, and other collateral material. As a bonus, this is where all those questions you asked, we were just taking a look at them during lunch, all the questions that you asked will get answered in a few weeks or so. Find your questions, and better yet, get those answers. The home health quality reporting data submission deadline. We all need to know about deadlines. Which ones are related to data submission is critically important to ensure that each of you have a plan for accurate and timely data submission. This page provides you information on where your data needs to be submitted and when you can see that data reflected on your reports. And your quality managers, this is the page you want to visit when planning your quality calendar. When do you want to run those reports to ensure you have the most recent data at your fingertips? It's this data you'll want to share with your field staff and let them know, hey, how are you guys doing? And where are there areas for improvement? Okay, so now that we've gone through this, I'm going to go ahead and return to the presentation and go through a few other resources. Okay. So the first one I'd like to talk about is one that we kind of touched on, but I really wanted to spend a little bit more time with. And this has to do with, on the HHQRP, we have the OASIS data set and the OASIS user manual. These are contained within the download section of the data set page. And you'll find that actual OASIS-D item set that is effective 1/1/19. You'll see that in the download section of the OASIS-D guidance manual, you'll find two appendices, Appendix C and Appendix G. Appendix C is the listing of the items and the time points and uses, whereas Appendix G is the change table outlining all of the revisions, additions, and removals found in the OASIS-D data set. Remember, OASIS-D is to be implemented with all assessments with an M90 date assessment completed date of January 1st, 2019 or later. Okay. OASIS Educational Coordinators. So this resource can provide you with guidance related to item intent, response-specific instructions, and other information related to the OASIS dataset. However, just as a reminder, the training and technical support in integrating OASIS items does not include assistance with electronic health record questions. In most circumstances, your EMR vendor your EMR vendor contract will include a clause that mandates that when it comes to displaying the OASIS dataset, that they are in full compliance. We invite you to check with your EMR vendor to ensure that they do. The help desks. Have any of you visited or posted a question on the help desk? If not, you are absolutely welcome to do this. If you have questions, ask it here. For the HHQRP and OASIS guidance related questions, it's going to be the Home Health Quality Help Desk that you'll want to reach out to. For the conditions of participation related questions, and I know there are a few out there still, the Home Health Agency Survey Protocol mailbox. And for the Home Health Prospective Payment Systems, payment policy related questions, the Home Health Policy mailbox is the place you'd want to go. To go into the Home Health Quality Help Desk a little bit more, there is the email that you're going to want to use. And examples would include quality manuals, quality measures, risk adjustment, public reporting, QAO or pay for reporting requirements, and measure calculation. So if you have questions with regard to that, that's where you're going to go. Your technical help desk has more to do with reaching out for those questions related to data submission and the Casper Keys notice, Casper Keys systems. And notice there are 3 convenient ways to reach out. So we're giving you different options for how you can reach out to us, by phone, email, or even on the website. Okay, the help desk disclaimer. So this is an important component. When you are submitting help desk questions, please do not send any identifiable patient information through email, such as medical record numbers, dates of birth, service dates, or any other patient identifiers or protected health information. Proposed rules and final rules are published in the Federal Register and are typically released each year in July and November. Proposed and final rules are posted on this webpage that's listed there. Of course, there's been a lot of talk about the IMPACT Act today. There's a whole page dedicated to the IMPACT Act, and we invite you to go there if you have any other questions with regards to the IMPACT Act. Another resource is the Medicare Learning Network. So what's great about this is if you've never ever visited this site, I really suggest that you do. Especially if you have questions that you want to find out more information about with regards to CMS programs, policies, or initiatives. You can subscribe to weekly emails, and that way you'll never miss out on the newsletter highlighting important topics that we need for our industry here. We invite you to stay connected through the Open Door Forum. Notice it says home health, hospice, and durable medical equipment, but the fact is that this is our home health Open Door Forum. This is where you can hear and share your concerns with regards to Medicare and Medicaid programs, issues related to the home health PPS, new proposed competitive billing for durable medical equipment, and the Medicare hospice benefit are all topics that the forum has covered. They too have a newsletter that you can subscribe to. And finally, I want to leave you with the Spotlight and Announcement page and the Home Health Quality Reporting Training page. We already reviewed these, but I want to highlight them because this is where you're going to go for additional training announcements and registrations. And that reporting training page is where you're going to find today's stuff. So if you want to go back and look at things, the answers for all the scenarios will be posted there eventually, so it's a really good page. So now what I'd like to do is actually invite you all to do a bit of a scavenger hunt. So you all should have in your folder the Home Health Quality Reporting Program website scavenger hunt. So if you want to get together with some friends that might have a computer and take a look, because what we're going to do is there's a series of questions here that I'm going to look for you guys to answer and tell me where these resources can be found. So it looks like we're running a little late, so I'm just going to give a few minutes for this, and then we can talk about the answers. I'm going to come down and peruse and see how you guys are doing with that. Okay, I know I didn't give everyone a lot of time, and I apologize for that, but we are going to go through the answers. So these are some of the pages that we have found, or resources that we have found have been most helpful, and we wanted to make sure you guys knew where to find them as well. So we're just going to go through it, and you'll have the answers. That way you have exactly where to go to find them. So today's training agenda can be found in the downloads section of this page. Right, home health quality reporting training. Well done, nice. This page communicates important announcements and updates regarding the home health QRP. There we go, spotlights and announcements, excellent. The guidance manual for the OASIS-D version of the OASIS dataset is in the download section of this page. OASIS user manual, yes, nice job. This page provides a list of the current home health QRP measures, including descriptions of each measure type and links to measure specification. This one's a little harder, I think. Home health quality measures. Okay. Registration announcement for today's training was posted on the following 2 pages. What do we think? The home health quality report training and the spotlight and announcements. That was that last slide I had up. Want to burn that into your memory. Answers to provider questions from this training will be posted in the download section of this page. We may not have gotten to that question yet. It's the home health quality reporting training. This page provides agencies with the quality assessment only reporting schedule for 2018. One of the first pages we looked at, yes, the quality reporting data submission deadlines, nice. Okay, 9 measures included in the quality of patient care star rating are identified on this page. Right, the star ratings, nicely done. So yes, the HHQRP website is your primary resource for information regarding all aspects of the QRP. Several home health QRP help desks are available to assist agencies. Additional resources that provide free educational material on CMS programs and policies and initiatives are available.